well, James Endow, European Association of Urology. You're developing guidelines in your field. What will this mean for practitioners and for patients?
Thank you ever so much. We develop about 21 guidelines that are updated every year, and they cover the breadth of urological diseases. And the purpose of this is to improve the outcomes of patients and to harmonize care, actually. And they're now endorsed by all 28 EU member states. And so the opportunity to standardize care across 28 EU member states is there using the guidelines framework.
Do different countries face different issues in terms of maybe the technology that's available to them or the issues that they face even?
Absolutely, and that, I suppose that is the crux of the matter, that in the EU, across different member states, you have different health systems. Even within a particular country, different regions or different hospitals have different issues that they have to face. So harmonizing care, as you can imagine, then is extremely difficult, right? But I think what the guidelines do so well is they present a framework to clinicians and to stakeholders, especially patients, to say to them, given the wealth of evidence that's out there, that is overwhelming, the guidelines look at all of that and distill it down to the most important evidence that should inform the care for particular conditions. And it gives them options, and it tells them how strong that evidence is and whether it's not so strong. And if it's not so strong, allows the patient and the clinician to enter into a shared decision-making type of relationship, which is what it should be.
Doctors complain today that patients arrive in their surgeries having done a Google search for their condition and telling them, the expert, the doctor, what is wrong with them. Is this progress or is this a backward step?
I think having patients that are better informed is always progress. But like with anything in life, there are obviously downsides, potentially. And what are the potential challenges? Exactly what you've mentioned, that patients come in sometimes, not only are they well informed, but they may have already made up their own minds as to what's wrong with them, right? And what the best treatments are for them. But obviously, that is a risk because they may well not have had the right diagnosis made in their own minds, right? And so I can understand the frustration of health professionals, but I would far rather have the opportunity of discussing and sharing knowledge with an informed patient who maybe does not have the right diagnosis from their Google search, but at least they're knowledgeable. And I feel more comfortable with that than talking to a patient who has no knowledge and depends on me telling them what is best for them, when actually they are the best at telling you what their outcomes that they desire should be.
And if the patient said to you, I think this homeopathic remedy is the best one for me?
I would always struggle with a patient that says it is the best for them. I would rather have that conversation to say these are all the options, and the options for them would include the homeopathic option. But clearly I will also be honest with them about my own limitations in my own knowledge about, alternative medicine that I perhaps don't know enough about. So I would present them with evidence of what I know, and I will encourage them to reflect on that in making their choices. But I will not ever say to a patient, do not try something else, unless I believe it's going to be harmful to them.